there are so many other issues that are involved, but I think that our hormones are, I think, the basis.
There are a wide range of illnesses, physical changes, and medications that can cause low sex drive. Alcohol and drugs, surgery and fatigue are risk factors, as well as hormonal changes from menopause, pregnancy, and breastfeeding. Now, psychological risk factors, they include anxiety, depression, stress, poor body image, low self-esteem, and history of physical or sexual abuse. Now, relationship issues, they can contribute as well to decreased sex drive. Now, a lack of connection, poor communication, unresolved fights, and infidelity can also contribute. Now, please welcome Dr. Reene Horowitz. Thank you very much. Horowitz, thank you very much for
Thank you for having me.
I appreciate it. Try to enlighten us a little bit about this important topic, you know. Now, what about hormones? We talked with Stacy, and she had her ovaries taken out. How important are hormones in this topic of low libido?
Well, of all patients that have sexual dysfunction, sexual problems, the highest incidence are patients who have had a hysterectomy between the ages of 20 and 45. Almost 76% in one study. Now, that didn't look at pain, that just looked at libido, orgasm, and arousal problems. So she was a setup for having a problem. Hormones are very important to all parts of our lives, and especially our sexual life. And it starts in the brain, where estrogen, testosterone act, and they increase some of the neurotransmitters in the brain that cause excitation. If you think of it like a scale, where there are some hormones that excite us and some that balance, inhibit it. It is, and it's always a balance. And so people who have elevated serotonin from SSRIs, from the antidepressants, the Paxil, the Prozac, the Zoloft, are going to have high levels of dopamine to balance that out and to be excited. Now, hormones also act on our genital regions, so they keep our vaginal tissues, our vulvar tissues very healthy. And if you don't have them, eventually you're going to have pain. If you have pain, you're not going to want to have sex. I mean, sex should be fun. It should not be painful.
So, simple question people are asking, so why don't we just give a bunch of hormones to replace it? Why doesn't that solve the problem? It's not as simple as that.
It's not as simple as that, because if you think of sex as, I think of it as kind of a jigsaw puzzle, and you have to have all these pieces in place. And so it's not only the hormones, it has to do with the relationship. What you talked about, your body image. Do you have privacy issues in the home? If you're going to have a 17-year-old kid, as my husband and I did once, pop into the bedroom at a very inopportune time, you're going to be thinking about maybe not having sex. Yes.
Or putting two locks on
the lock went on the door. So there are so many other issues that are involved, but I think that our hormones are, I think, the basis. And I think that giving, I think that it's estrogen that makes us female, it's testosterone that kind of gives us some energy and drives us, and it's really, I think it's important to replace them.
And so Dr. Horowitz makes some important points, is that, you know, it's also physiologic. I mean, there's some things going on that are not in your control that really change your libido. What can we do to combat this? You're wondering, okay, so we got these problems. What medically can we do to change your libido, to increase it?
Well, I think that in Stacy's circumstance, we were talking, and she's on an oral estrogen. Okay, oral estrogen, it goes through the liver. When it goes through the liver, it increases sex hormone binding globulin, which, as you know, is a protein that binds to the free-floating estrogen, testosterone in our system. If it's bound to sex hormone binding globulin, it's not available to be used in the target tissues. So it's a huge problem to be taking oral estrogen, because that increases the sex hormone binding globulin. So a transdermal approach, I think, also is very important. On the skin, yes. Put a patch on the skin or a cream on the skin. I think that it's also really important that these hormones are measured, especially when you're playing with testosterone in women, because there are side effects, and there can be very significant side effects that are irreversible.
Yeah, and so we replace it, but in Stacy's case, that just changing the route of how she gives her medicine and then the formulation may be useful. Now, when you have, she said, you know, a lot of compounding pharmacies are making this. It's a little different topic, but are people worried that are getting the wrong medicine, or is it not safe, and could there be complications of this?
I think that it's really important to know your compounding pharmacy, for your doctor to know, are they licensed? And because you really don't always know with the compounding pharmacy how much you're getting. Is each dose going to be the same?
Right.
Versus pharmaceutical, where you do know. And I prescribe both. I am comfortable prescribing both, but I have vetted the compounding pharmacies, and the one I use, I feel very comfortable with.
Okay.
That I think my patients are getting what they need.
And with Stacy's case, do you think most of her problems from the hysterectomy or otherwise?
I think most of her problems are from the hysterectomy. I mean, you look at her timing. 6 months afterwards, she's just gone. I mean, but she needs other things tested. She needs to know her thyroid is normal, that she doesn't have,
Sure.
her prolactin isn't elevated. She doesn't have high cholesterol.
These are all other hormones. I'm just sorry to interrupt you.
Yes.
But, that could also play a role. But go ahead, please.
That she doesn't have hypertension, high cholesterol. What medications is she on? Are there medications that are decreasing it? So it's, what is her relationship like?
Yeah.
Does she have time? Is she worried about her body image?
It can be very complex.
It's
So
very
when you're having
complex.
this problem, obviously you may have multiple doctors, and we like that, that you may have to be able to see somebody like Jill, who's an acupuncturist. You may see somebody like yourself, but have the whole picture and use all your techniques, because the bottom line is it's an important problem and you need to solve it in order to get the best you can out of your life. So I appreciate you taking the time.
My pleasure.
Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.